Hey guys, let's talk about healthcare today. So, as it stands, if Congress doesn't do something, millions of Americans are going to be getting a healthcare bill they just cannot afford. And there's other millions of Americans that are getting a huge increase in their premium. So, for example, my girlfriend and I are both paying roughly $200 to $300 more in the next coming year. That's $600 in just this household alone, and that's just the two of us. We can afford it because we're millennials without kids, so we're fine. But a lot of people are going to be in big trouble for this. The thing about Obamacare is it passed in 2010 and it gave health insurance to 45 million more Americans than previously had it. So a net benefit in a very extreme way. Fast forward to 2020, after years of just inflation and price hikes through insurance, we had to pass a bill because of COVID to tack on these subsidies to make healthcare more affordable. It was just a band-aid on a bigger issue, but nevertheless a band-aid, and we really needed it, and it helped millions of Americans keep their healthcare. Now let's get to where we are now. We have to do something about healthcare. There's two sides to this. We got the Dems, we got the Republicans. The Democrats right now, they want to do the same thing they did before. Let's put a band-aid on it and let's give us 3 more years, and in those 3 years we'll figure out a way to get prices down. That is the current Republican plan. Democrat plan. Republicans, it's hard to say what their plan really is. They're kind of all over the place, and the few things that we have heard are very nonsensical and they don't make sense. And I'll explain to you why they don't make sense. It's because the Republicans are coming at this in bad faith. They don't like Obamacare for the main reason is because Obama made it. They don't like Obama for various reasons. The main reasons is because he's a black guy. Let's just all call a spade on that one. Other than that, I can't see any reason why they're just totally against Obamacare. They've been trying to replace it for 10 years, 15 years, and it's just been a failure. They haven't come up with anything. And you got to look at the Republican Party. Like, the Republican Party is made up of guys like Rick Scott. Rick Scott was the CEO of a company that was found to have committed millions of dollars in Medicare fraud. He didn't get convicted because he's rich and he's part of the rich people don't get to go to prison type of thing. So Rick Scott, you're not the best spokesperson to be talking about healthcare, but this is the best the Republicans got to put someone out there to talk about healthcare that was definitely involved in some Medicare fraud. That's just rich to hear him talking about fraud. So anyway, let's start with the Republican. I got a couple clips of the Republicans talking about discussing how they feel about Obamacare.
That's the problem. Obamacare was sold on a lie.
Mm-hmm.
They said, "Oh, you keep your doctor, lie. Keep your plan, lie. Oh, you're going to save $2,500 a family." Complete lie. Think about it. Premiums are up, payments are up, deductibles are up. And by the way, remember the government was going to save money with Obamacare, and it's costing us it costs us unbelievable amounts of money right now.
Republicans knew it was bad
Yeah,
10 to 15 years ago.
they didn't vote for it.
Not a single Republican has ever voted for any of these provisions.
That's the problem. Obamacare was sold on a lie.
Mm-hmm.
So it's just that argument is just so like nonsensical. Like more people have health insurance than they did before it, and the rest of it is just what does it even mean? I don't.
That was the lie, and they got people hooked on it, and now
They got people hooked on health insurance. What kind of a talking point is that?
it's a morale issue. It's a psyche issue. It's like you shouldn't go get a job because you can't do that. Just be dependent on us, the government. And I think
So I think what he's referring to is if you don't make a certain amount of income, you could get government insurance. But what ends up happening is that people are stuck at their job that they hate because they need health insurance. So it's just a weird argument. It's a weird thing to say.
Bobby Kennedy and what President Trump and what people are trying to do is say, no, your value is a lot more. Go get a better plan. Go have some choice and some competition. That was the lie. And
I don't. It's kind of what he's saying there is the way we want like the private sector to take over it, but that's kind of what it already is. It's so nonsensical. So we do have some text of Republican plans as well. This one's from the Republican House Committee. One of the Who was it? Representative Wahlberg. Never heard of that one. But anyway, here's what he's saying about his plan. My bill, the Association Health Plans Act, allows small businesses and self-employed Americans to band together, like large companies, to lower cost and deliver high-quality coverage. The CBO estimates that this could cover more than 200,000 previously uninsured Americans and attract 700,000 people annually to association healthcare plans. Okay. I allow small to band together. So, okay. Completing this, the Self Insurance Protection Acts authorized by shield small businesses from regulatory overreach while expanding affordable healthcare options. Together, these measures included in lower healthcare premiums for All Americans Act, cut red tape, protect choice, and lower costs. That is nonsensical. I don't know what he's saying exactly. But when he talks about shield small businesses from regulatory overreach, what he's talking about is small businesses, hey, you are not going to have to pay health insurance or be responsible for health insurance for anybody. All right? They're on their own. It reminds me, actually, I currently work at a bar, a restaurant, and the ownership of my place is, they're very rich people. And I was overhearing a story about how they banded together with other small businesses in the area to give people more hours at another bar, so they didn't have to have that person on full time, so that they didn't have to cover health insurance for them. I mean, that's dark, man. That's dark. Next is
not change.
I mean, it's the House Speaker himself. Let's hear what he has to say about healthcare.
Renewed, handled in some way. Last time you were here, we talked about Congresswoman Marjorie Taylor Greene, who had some real frustrations about this. Where is the Republican plan? I know you two had talked. Well, she posted this on X this week. She says, Johnson said he's got ideas and pages of policy ideas, and committees of jurisdiction are working on it, but he refused to give one policy proposal to our GOP conference on our own conference call. Apparently, I have to go into a SCIF, referencing a protected intel sharing type place, to find out the Republican health care plan. And there are a lot of exclamation points there.
Yeah. I don't know what to say about that. I mean, that's absurd. Obviously, we're not going to be on a conference call explaining all of our plans and strategies for healthcare reform, because they're leaked in real time, literally, when I have a conference call with all my members. It's
So what if they're leaked? Like, it's not like something confidential or something. What are you guys talking about right now? Like, you should be sharing that.
They're supposed to be private, but they're not. And so Marjorie knows that. She knows she can come into my office any day at any hour, and I'll lay out everything for her. The committees of jurisdiction, the people who specialize in all of this, have been working on this around the clock for a long time. In fact, we published 60 or 70 pages of healthcare reform ideas in 2019 when I was the chair of the Republican Study Committee, the largest caucus in Congress.
They didn't. They absolutely did not. And if they did, it was a bunch of bullshit that doesn't make any sense.
Our ideas have been out there for a long time. We're formulating the final plan that will bring down premiums. There's only one party in America that is going to do that. Remember, the Democrats are the ones that created the system that is failing us. They created Obamacare. They said it was going to bring down costs. It's done exactly the opposite. Premiums, by some estimates, are up 60% since Obamacare was created in 2010. So it's the Republican Party that is going to bring down the cost, not the Democrats. They've already proven what they're about.
Okay.
Again, that's just, what is he saying right there? Like, it's just a bunch of it's a word salad. He's not saying anything. He's not committing to anything. It's just weird. Like, we can't. So weird. Okay. So this is one of the main texts that I've seen from the Republican Party. So lower premiums and better options. Republicans are working to lower healthcare costs for everyone, give Americans more options for healthcare, and fight the middleman. Okay, so here's their points. So we're going to do associated health plans, choice accounts, health savings accounts. So the first two, I'm not sure exactly what that means. There's going to be more health insurance companies out there. That's kind of what I'm hearing there? Are those private companies, or are those like government companies? Health savings accounts. So what they've been talking about is giving everyone $1,000 or $1,500 to put in their health savings account. But if your deductible is $10,000, what is $1,000 going to do for you? Not a damn thing. Okay, cost sharing reductions. Okay, codify Trump administration rules to fix Unaffordable Care Act, PPM reform, innovation, price transparency. What does price transparency even mean if it costs $1 million? Like, I don't need to know that. Site neutrality and provider-owned hospitals. Okay, so we're gonna give insurance companies hospitals? Is that what that means? Like, it just, I don't understand what any of that means. You know,
So
it seems very just nonsensical to me. Just to put it in a little bit more like clearer terms, it's all nonsensical to everyone. Like, it doesn't make sense to anyone, and that's kind of like where we're at. One of the smarter people that are at least coming from a good place is Senator Bill Cassidy, and even his stuff makes absolutely no sense.
Here is the difference between the two accounts. Who gets the money? Under their plan, insurance companies. Under our plan, patients and families. What can the money be used for? Well, here it's subsidized premiums. There, which means that the insurance company gets it and takes 20% for deductible and copay. Under our plan, you can use it for your doctor visit, your x-rays, to see your dentist, your glasses, your prescriptions. This is real medical care, not something the insurance company permits you to have. Who makes the decision? Under their plan, the insurance company. Under our plan, power to the patient. We want that patient, we want that mama, we want that wife, because they're the ones who always make the decisions on health.
Hey, look, that's a great slogan, but what you're saying, what Cassidy is saying, it's nonsensical.
Here, to be the one that has the power. Contributes to lower cost? Under their plan, no, because it goes to the insurance company that continues to pay those higher rates. To the patient, if you give her this money, you got $5,000 to spend it wisely, she's going to say, wait a second, the x-ray is...
You're giving someone $5,000. Who are you giving $5,000 to?
It's $150 here and $500 there. I'm going to where it is cheaper, not more expensive. And I can tell you when that begins to happen, the people who are more expensive begin to lower their price. This is a plan that by sending it to the patient for real care, to the patients with the power, you empower the patient to shop, driving competition, lowering healthcare cost. And we just heard from Senator Crapo.
If you need x-rays because you just got injured, you don't have the time or the bandwidth to be shopping around for the cheapest x-rays. Your doctor orders x-rays, he sends it to where he wants the x-rays, a place that he works with, and you get the x-rays. We're not shopping for x-rays when you break a leg. Like, that's stupid.
The plan that my Democratic colleagues support, we've seen widespread fraud and unauthorized enrollment.
Like Rick Scott? That kind of fraud? Is that what you're talking about?
Our plan.
I don't give a shit about fraud.
If you got a health savings account, it's pretty easy. I just signed up for a similar type of account on my healthcare. You got to show who you are. It's not really hard. It took me about 5 minutes. But the banks that manage this money are going to require that you identify that you're a real person. This is an anti-fraud program.
What banks? What banks? Like, the more he talks, like, the more, like, I just straight up just have questions. I don't know, like, what he's talking about. It just doesn't make any sense what they're saying right now. That plan, it's there's some slogans in it, but it is so light on details and just on its face doesn't make any sense. What the hell are you guys talking about? All right, before we get into what the plan really is, Chip Roy, this guy cracks me up all the time, but he had a bit of an outburst recently. Let's just check in on him, make sure he's doing okay.
Other side of the aisle sit here saying, well, you guys aren't doing anything about the massive expensive cost of healthcare. Why do you think it's expensive? Because you literally cut a deal with insurance companies to run healthcare. You think that's going to run wild? Yeah.
Main thing is health insurance companies are main part of the problem. All their incentives for them to make money, the administrative costs, health insurance companies are the problem. The issue with that is that it doesn't matter what side of the aisle you're on, Democrat, Republican, both sides are in the pockets of the insurance companies.
Yeah. That's why they have 2,000% profit increases, and the American people can't afford to go to the doctor of their choice while we enrich insurance companies. And yet Republicans will complain about it, and then they'll offer milquetoast garbage like we're offering this week, and then go home at Christmas and say, look at what we're doing. We're campaigning on reducing health care. Well, congratulations. At some point, people will look at this body and say, maybe we should get rid of all 435 members of the House and all 100 members of the Senate.
Chip Roy, it's weird because it's just like 4 years under Biden, the Republicans were just so nonsensical about everything. And then now that their party is like really starting to mess things up, all of a sudden we hear a lot of truth bombs. But Chip Roy nailed it. Like, you guys are trying to put together a bunch of stuff like you got a plan. And you know, to be fair, Cassidy, I think that he has a genuine, desire to fix things, but he comes off like an idiot. And he's in a party that is ran by idiots. So none of that's going to work. So the only thing I'm seeing right now is they're probably not going to pass a plan. Probably nothing's going to pass at all. And if anything did pass, the Democrats want to keep the subsidies going. It's a little late at this point, but we still need to put forth more money to that subsidies. Republicans, if their plan passes, it's not going to help anything, and if it's most likely going to make things worse. So, and in fact, it's hard to read the tea leaves as a regular person, but I found this to be very interesting. This woman, she seems to know a lot about healthcare, and she really knows her stuff. So let's see what the real cost of health insurance of this Republican plan will be.
Their healthcare proposal. This is the plan that they are offering instead of extending the ACA premium tax credits. Big surprise, this proposal will be a disaster for working Americans. Here's why. So Senators Cassidy and Crapo have introduced a bill that would give some Americans a health savings account with $1,000 or $1,500 in it and enroll them in a high deductible bronze plan instead of the silver or gold plans they have now. And you might say, well, that sounds fine, right? But it's not. Here's the problem. Bernie Sanders just released a report where his staff actually went and shopped for healthcare under this plan to see what it would really cost families. And y'all, it is brutal. We'll start with a couple in their 60s in Miami making $85,000 a year. Right now, they have a silver plan with a $0 deductible. Under the Republican plan, their premiums would go up $1,800 a month. That's over $21,000 more per year just in premiums. And their new bronze plan would have a $7,700 deductible. So before their insurance even kicks in, they would owe almost $30,000 in premiums plus that deductible. Or take a family of 4 in Kansas making $45,000 a year. Right now, they can get a silver plan with 0 premium and 0 deductible. Under the Republican plan, they would still have 0 premium, but their deductible would jump from 0 to $15,000, and their out-of-pocket maximum would go from $4,000 to $20,000. That is nearly half of their entire income just in potential medical costs. Here's why this matters. If someone in that Kansas family, say, has a heart attack, the cost would easily exceed both plans' out-of-pocket maximums. Now, the Republican plan would give them health savings accounts, but here's the kicker. Even with that money, they would still owe way more than under their current silver plan because of the massive deductible increase. And here's what makes this even worse. The Cassidy-Crapo plan also ends something called silver loading, which would actually raise premiums for another 10.6 million people by about $1,400. So even the bronze plans won't actually be cheaper anymore for a lot of people. And one more thing, the bill lets insurance companies sell plans with deductibles as high as $10,000 to anyone. And it puts an arbitrary cap on federal spending, which means the government could literally run out of money to fund these health savings accounts. Basically, under this Republican plan, you are paying way more in premiums and deductibles, getting less help from the government, and you're stuck with insurance that makes you pay thousands and thousands more out of pocket before it covers anything. The Senate is voting on this week. Link in the bio for the full Sanders report if you want to see all the numbers and examples. Get loud, because lives are at stake. And this plan is not how we save them.
Okay, so the main thing that I've been hearing is that, and I've seen it myself, my premium's gone up, my girlfriend's premium's coming up, people that I know around me premiums have gone up, but some of these numbers that I'm hearing about premiums going up, if that really happens in January, we're going to be in a big mess. People like me that can pay my premium that's way too expensive, we're going to have to pay more because other people can't pay theirs. This is a disaster, guys. This is not going to be pretty. We're literally driving off a cliff right now, and we don't have any brakes. So I'm gonna keep you guys updated. This is a rough story, and we got more coming from this administration. This is not the end of it, not the beginning. This is just the middle. We got a lot more to go. Stick with me, guys. I'll keep you guys informed. Maybe a few laughs along the way, but this is helping me get through this turbulent time in politics. So I'll catch you guys next time, guys.